Bruce Willis, used to being like the tough guy on screen, but a stunning announcement from his family saying that Bruce is vulnerable and needs help.
Yeah, the actor's family announced that he's stepping away from acting after being diagnosed with a condition that affects his ability to communicate. It is called aphasia. Joining us to explain, the program director of Northwell Health Vascular Neurology Fellowship, Dr. Rohan Arora. Doctor, nice to have you on Good Day New York.
Thank you, Rosanna and Bianca. It's nice to see you.
So what is aphasia? I never heard of it before. There were rumors kind of going around for years about Bruce Willis that maybe he had dementia. Is this a form of dementia?
It can be one of the ways dementia is present. Aphasia is actually a language disorder that happens due to injury to the brain. And it can happen two ways. Patients may have difficulty with speech or finding words, or they may have difficulty understanding what another individual is saying. Most aphasias are mixed, which is a combination of these two.
So, doctor, can you only get aphasia from like a trauma, or is there a certain time in your life that you have to be worried about this?
You can get aphasia anytime from an injury to the brain. Yes, it can happen because of trauma. However, those conditions happen right after a big trauma, which may result in bleeding inside the brain or some kind of injury to the brain due to the trauma.
So would there be any warning signs for this for people to kind of look out for, or is it just, something that you need to check after you have some major incident?
There may be warning signs in cases where it's slowly progressing. But in patients who have dementias, they may have slowly progressive language disorder, brain infections, brain tumors. In these cases, they may have warning signs and a slow progression of symptoms. However, most of the times, aphasia is present with strokes or a brain bleed that happens all of a sudden and changes an individual's life.
What about reversing this? What about treatments? Is this treatable?
Aphasia is treatable, and the primary person who treats this is a speech and language therapist who will work with the patient to know how much they can interact and understand and use certain techniques to help them recover from aphasia.
We've been hearing behind the scenes reports that he may have had it for years, that he was, being kind of nurtured and massaged through a lot of his, recent movies with earpieces that kind of fed him lines because he couldn't remember everything. So how quickly can you reverse this if, Bruce Willis has had this a number of years already?
Yeah, so it appears that there is an underlying condition that's leading to this manifestation, and there's not a very quick recovery path for it. It is constant reinforcement with a speech therapist and a neurologist and a neurorehabilitation team that can work with the patient to then slowly bring them back to how they were before. But most aphasias of this type, which happen over a slow period of time, may actually worsen and lead to maybe no speech or understanding in the long run.
Well, Dr. Rohan Arora, we appreciate you coming on Good Day New York and explaining it to us. We appreciate it.
Thank you for having me.
Thank you. And we wish Bruce Willis and his family.
Especially his family, too. I know they're certainly
not an easy
hurting
time.
that.